Our objectives are to describe the development of joint with examples and discuss some common congenital anomalies related to joint. Before going through the joint, let's have a recap of endochondral ossification, which you did in foundation module. Whenever any bone is to be formed by endochondral ossification, mesenchymal cells are laid down, and from those mesenchymal cells, cartilage model is formed. You can see cartilage model of humerus, one of the limb bone. When ossification starts, primary ossification center appears in the midshaft region, and the perichondrium in this region will no longer form the chondroblast cells. It will give rise to the osteoblast cells. Those osteoblast cells will form a collar of bone in this region. Because of the formation of collar of bone, the chondrocytes which are sitting in this region undergo hypertrophy, and the matrix around them will undergo degeneration so that they are only in the form of septas. The hypertrophic cells start to secrete alkaline phosphatase, which will be helpful in the deposition of calcium over the existing cartilage matrix. As there is calcification of the matrix, the chondrocytes will no longer receive nutrient or the oxygen by means of diffusion, and they die. At the same time, nutrient artery will give its branches in this region from the outside, and along with the artery, the progenitor cells, osteoprogenitor cells, also reach the area. And along with the circulation, hemopoietic cells will also come to this area. Now, the osteoprogenitor cells, which differentiate into osteoblast cells, they will start to lay down bone over the already existing remaining spicules of the calcified cartilage. In this way, bony tissue is formed in the shaft area. So at birth, whole shaft is ossified so that the collar of the bone, which was present initially, will form a thick compact bone at the periphery, and in the center there will be spongy bone around the marrow cavity. Only one part, that is the junction of the epiphysis and the diaphysis, that is the metaphysis having the epiphyseal plate, will remain cartilaginous. Secondary centers for ossification will develop either just before birth or after birth in most of the bones. Now, the joint development. Ossification of the limb bones starts at around 8th week, and the joint starts to form by mesenchymal tissue during the 6th week, and it is at the 8th week that they resemble the adult form. Majority of the joints in the limb are synovial in nature. Of course, we have other type of joint also, and when the synovial joints are being formed, they undergo different phases, like the patterning of the joint site, the formation of the interzone, which is very important, and then the cavitation for the formation of synovial cavity, and other morphological changes. Now, first of all, synovial joint. Most of the large and the small joints of the limb which are mobile are of synovial variety, and they are connecting the limb bones. When joint is formed between two bones, first of all there is mesenchymal condensation, and the bones will be in the form of cartilage primordia, and in between the bones, the area where the joint is to be formed will be called interzone. In the interzone area, there will be no cartilage formation, and the mesenchymal cells will form fibroblastic tissue, which is nothing but undifferentiated connective tissue. Now, the area of the interzone, which is immediately in contact with the bony ends, will differentiate into articular cartilage. The central part of the interzone will form different structures related to the joint. while at the periphery of the interzone, the joint capsule and synovial membranes are formed. As you can see in this adult structure, the joint capsule lies outside and internally it is lined by synovial membrane. So here the capsule will be forming from the interzone, peripheral interzone area, and it will be lined by synovial membrane. The central part of the interzone will differentiate into menisci or the ligaments, intracapsular or intra-articular ligaments. And if we take the example of knee joint, the menisci and the cruciate ligament are formed from the central part of the interzone. As these structures are forming, small cavities also appear, or vacuoles appear in the central region, and they merge to form a single large cavity, as you can see. This single large cavity is the synovial cavity, which will be filled with synovial fluid. Now, these are three examples of the synovial joint: interphalangeal, knee joint, and the sternoclavicular joint. The other structure, that is the capsule, the synovial membrane, are the same, but in case of knee joint, we can see that the central part of the interzone will give rise to fibrocartilaginous structure, that is the menisci. You may see them over here. And in case of sternoclavicular joint, the central interzone part will give rise to an articular disc, as you can see over here. Now comes the other types of joint, the cartilaginous joints. In case of cartilaginous joint, the interzone area will be differentiated either into fibrocartilage or hyaline cartilage, depending upon the type of the joint. Now, when the interzone is differentiated into hyaline cartilage, one example which we could see over here is that of the manubrium and the first rib joint, the joint which is formed between the first rib and the manubrium part of the sternum. In this case, hyaline cartilage is formed between the two bony areas. Here in the hip bone, in the two hip bone, pubic symphysis is another cartilaginous joint where fibrocartilage is present between the two bony areas. Now the fibrous joints. Again, it is very simple. In case of fibrous joint, the interzone area will differentiate into fibrous tissue. And if you remember the examples of the fibrous tissue, sutural joints have got fibrous tissue. They are example of the fibrous joint. Then inferior tibiofibular joint, they are another example where between the two bony areas, fibrous tissue is present, forming the fibrous joint. Now the anomalies. A very common anomaly which you could see in our country also is the developmental dysplasia of the hip joint. There is dislocation of the hip joint which is formed between the head of the femur. This is the head of the femur, and this is the part of the hip bone, the acetabulum. The acetabulum is forming a cup-like structure in which the head of the femur fixes. Now, there are different degrees of dislocation of the hip joint. There may be subluxation, in which the joint could be replaced by doing without surgery, just by manipulation. But there are other factors, soft tissue factors, which are responsible for the dislocation and the retention of the dislocation. So it is one of the anomaly related to the hip joint. Congenital joint hypermobility. There are three connective tissue disorders in which we could see hyperflexibility flexibility or hypermobility of the joint. One is Ehlers-Danlos syndrome, other is Marfan syndrome, and the third one is osteogenesis imperfecta. In Ehlers-Danlos syndrome, there is a mutation in the genes which encode for the fibrillar collagen or the enzymes which are responsible for the modification of collagen. So basically we have multiple types of collagen fiber, and it is basically the defect of the collagen which is causing this syndrome and is responsible for the joint manifestation of this syndrome. In Marfan syndrome, again there is mutation of the gene which is encoding the fibrillin protein, and in this syndrome usually the individuals are very long and thin, their arms and legs are very thin and long, and there is hyperflexibility of the joints as you can see in this diagram.